Ladies and gentlemen, welcome to sqadia.com. My name is Muhammad Osama, and today we are going to talk about the anterior or the ventral aspect of the wrist and the palmar aspect of the hand in this lecture, in which we're going to talk about the bones and the joints at the level of the palmar aspect of the hand or the wrist, but regardless of the palmar or the dorsal aspect, we have the same bones and the joints, and thus we are going to talk about the bones of the hand, the bones involved in the formation of the wrist. We're also going to talk about the wrist joint and the movements possible at the wrist joint, as well as the joints of the hand, including the intercarpal, midcarpal, carpal, metacarpal, phalangeal, and proximal and distal interphalangeal joints, and their function and movements as well. Moving on, we're going to talk about the extrinsic muscles of the hand, in which we're going to talk about the three layers of the extrinsic muscles which arise from the forearm and exert their function at the level of the wrist and hand, including the superficial layer, the intermediate layer, and the deep layer of extrinsic muscles. Afterwards, we're going to talk about the intrinsic muscles of the hand, which have their origin as well as insertion and action at the level of the hand. And they include the thenar muscles, the hypothenar muscles, and the deep palm muscles. The thenar muscles stand for the muscles acting at the thumb, and the hypothenar acting at the digiti minimi, or the little finger, or the fifth digit. And moving on, then we will talk about a very important anatomical structure which also has a great clinical significance, which is the carpal tunnel. We're going to talk about its structure as well as its contents, and we're also going to talk about the flexor retinaculum and the palmar aponeurosis, or the palmar fascia. At the end, we're going to talk about the blood and nerve supply, in which we're going to talk about the cutaneous nerve supply via the median nerve and the ulnar nerve on the palmar aspect of the hand, as well as we're also going to talk about the blood supply on the palmar aspect of the hand, including the palmar carpal arch, the superficial palmar arch, and the deep palmar arch. I hope you would learn something new out of these topics, and stay tuned for more lectures like this on sqadia.com. Thank you very much.